too long since we talked before, but yeah, more stuff we gotta check in about. I think what prompted this was because I called in for the diazepam refill, and yeah, it seemed like that was being used fairly often, so I thought it was worth another visit to kind of check in about some of those mental health things, because we didn't really get into that last time. But and I think maybe the note said you wanted to talk about ADHD medication as well. Is that correct?
I want to talk about medication in general.
Okay. Yeah.
The nurse said that you were going to send me a prescription for diazepam, and then she never sent it. And then she said that medication is only supposed to be for appointments.
Or like medication changes, maybe? I don't know. That might.
No. The diazepam.
Or that's what the prescription said, at least, is that it was to be taken for pain or anxiety for appointments. I don't know. So that's what I was going on.
Okay. Yeah. Okay.
Yeah. But a couple things, Risha, before we get into all of that, I just need to quick confirm with you some administrative things like medication allergies. It looks like the only thing we really have listed is the omeprazole. It causes hives and rash. Is that correct?
I don't remember that.
Okay. It was a long time ago, it says. Otherwise, were you able to look through the list of medications ahead of time?
I don't ever look at them because I don't remember to take them. I looked at the Adderall and I looked at the Zolpidem, and I looked at mostly the ones that I took PRN that I I will take when I'm having the issue. But the med list is not accurate because there's medications that are missing because doctors decided not to either add them or to hold off on continuing prescribing them because they know that without an administrator, it wouldn't be like it didn't make sense to them to prescribe something that they know that is not going to be taken on a regular basis without the med administrator.
Okay. So, in terms of pills you're taking, actually taking, you said the diazepam and the Zolpidem, I guess?
They're PRN.
Yeah. Anything else you really take these days?
Adderall
you are? Okay. And I couldn't find recent prescriptions, I thought, for that. Was someone else
for who?
For the Adderall.
That's because I was with SSM for a month and a half, and she made me sign an agreement not to have any what are they called, controlled substances prescribed other than her. So
I forgot that you were over there last time. So sorry. Actually, why doesn't that? It should. Let me look here.
Because I've already seen that the last date that I was prescribed that medication was on the 21st of last month.
Okay. Yeah. All right. And how often do you take the Adderall?
I'm taking it whenever I feel exhausted. So I could be taking it more, I could be taking it less. But I know that I had some left over. But the issue is that I couldn't find the bottle, and that's what prompted me to ask for it to begin with.
Yeah.
Because I couldn't remember where the bottle was. And then I started looking to see when it was last prescribed. Should I be getting a new prescription of it? What was going on?
Okay. So you feel like you take it when you're tired, huh?
So I assume that when I'm feeling like I'm going to pass out tired, that it wasn't taken.
Uh-huh.
Because, like I said before, I take medication in the moment when I feel yeah. Because I can't remember the days, they're all connected. if I didn't have like appointments and stuff, I wouldn't know what the days were. Like, yeah.
Yeah. Okay. Uh, so you might have used the Adderall almost every day, I guess, because you.
I know that I had some left. I can say that. So that means
Yeah.
I missed days.
Yeah. Besides helping you not feel so tired, does it do anything else for you really these days?
It keeps me able to get up. That's about it. It's been documented forever. The only reason why the medication is being taken is to help with function. I can still forget that I'm cooking and stuff when I'm on this medication. The neurologist or whatever they are, they've already did testing and said that even on these medications, they're not working. They're not being prescribed correctly, or there's supposed to be more medication added on top. There's an issue with these medications and they've never been solved. And it's been like, I think 3 years since the first recommendations. I was looking before, like earlier, like it's been like 3 years for the first recommendation to have the doctor to figure out why the ADHD medication is not helping. And then there was a recent one when I was diagnosed with severe ADHD and autism through Arbor Mental Health. It said that they even with the medication, they didn't even know I was on ADHD medication that day when they tested me, and it was severe.
Yeah.
And I think I was on 70 milligrams of Vyvanse at the time.
Yeah. Yeah, that's a high dose, so of Vyvanse.
Yeah, I was on a high dose, and I still was having issues, and there's been different doctors saying different things, and I'm not a doctor. I just know how my body feels, and I need help. But I've been probably to like 9 psychiatrists, and they've all said different things. Even one in group health saying they don't even think that I have ADHD.
Yeah, there's not a real test to prove you have ADHD. It overlaps with a lot of different possible problems that adults can have, especially. So it's, and a lot of other factors can make symptoms worse or make them better. Depends on what's going on there. It depends on a lot of other mental health issues or physical issues that are going on. So, yeah, it's not surprising that you're getting some different answers, because, to be honest, there probably isn't or as time goes on, there might be different answers, that are actually true for you. That sometimes it might be ADHD, I don't know. Sometimes it's other stuff going on. Or, maybe there's other reasons people have attention problems as well that aren't ADHD, and especially anxiety is a really common one. And it can be just as bad, if not worse, than ADHD for a lot of people. So I'm not saying necessarily that's what you got. I'm just kind of telling you in general that's some of the stuff that can happen. So, all right. So it sounds like you're hoping to, just talk about sort of mental health medication in general and anything that might be able to help you. Is that right?
No, I want to talk about medication and medication administration and coordinating of care.
Okay, tell me what you mean by that.
Okay, I put it in I always send this stuff in my chart before, because like a chat GPT explains this stuff, because I can't. I can explain stuff like credit scores, but I can't explain how I feel or what I need. Hold on a second. So it says, so my main goal is supposed to be to talk about restarting a higher dose of medication, because whatever they're giving me is not working. And anxiety medication treatment, not limited to appointments. My last doctor did not limit me to just appointments, especially with the stress that's going on with my choice and me not getting the care that I need at home regarding them and the property manager living in the conditions that I'm in, the accommodations that are being ignored. Like, I'm ripping my hair out all day long. I'm on the phone all day long. I cannot stop pulling my hair out.
Okay. Yeah. I see this.
Like, I need, like, somebody to, like, cut my hair off, like, immediately, because it's just, I'm spending too much time pulling my hair out. It's non-stop. Whenever I'm not out in public with my hair covered, I'm just pulling my hair out.
Yeah. You're super stressed, huh? Is that what you're saying?
I'm being neglected is what I'm saying, and I'm pulling my hair out because I keep repeating myself over and over. And this is like, it's been over 4 years, and I've been saying literally the same things over and over again. I've had APS call. They have it to where that every time somebody contacts them, I'm being screened out. I call CPS, I'm being screened out. Every program that we were in, we were being, screened out, or like we have no support right now. So that no one can say that I have support in place that I don't have. The only
Child Protective Services came out like earlier this summer. And
I've had a child protective. Those people have been involved since I think 2019, and they've done nothing.
So they just said everything was fine. They didn't.
They said that they will not put me in a safety case. So all this time, they've been putting me in resource cases, and that's why I have not been getting help. It's because they're putting me in resource cases, buying Christmas presents when I have doctors saying it's medically unsafe for me and my kids to be in this home without caregivers. And then I have my choice pretending like they put in 50 referrals for caregivers when they have to do what the last functional screen says, which is it says like safety things like a million times. It says that I'm required an overnight person at my home. I'm supposed to have care in waking hours and night hours. But because they're an insurance company, people think that they can dictate what they can and can't do. This is an insurance company. They're not a doctor. They're not providers. They're hired from an insurance company to make sure that I'm in the least restrictive place, and they don't have to pay the money out. So if you have APS purposely screening me out, because I have the whole file of them telling whoever takes the intake never respond to me, and then I have police threatening to take my license away when I'm calling in for neglect and telling me that they're not taking any of my reports in writing, this is getting out of hand.
Okay.
So at this point, I really don't know what other way to get the help that I need other than coordination of care. And it's required through Medicaid and Medicare for my choice to have coordination of care. So Dr. Fowl said that she contacted Tasia, who is a case manager, not a nurse, who told her it didn't matter what she said to them, that they were not going to provide whatever care that she said when that's illegal. Because in order for long-term care to work, the doctor has to coordinate care with my choice. Without coordination of care, they can do whatever they want. They can deny whatever they want. They can delay whatever they want. And I'm really tired of filing complaints, especially in Dane County, because they all know me and they just ignore everything. So I'm tired of filing those complaints. I'm tired of doing reviews. I'm tired of calling news companies. I think the problem is what people don't understand is that, okay, before I was fine and now I'm not. My mom has been here for at least a month, but because we're living in a 2-bedroom apartment, there's 5 of us in a 2-bedroom apartment, and she has nowhere to sleep, or my son's needs are super high. his behavior is outrageous. Every time he acts up or whatever, she's ready to leave. So if she's the only help that I literally have, and all she does is cleaning, she won't give me my medication. I've asked her a million times. She told my choice that I was retarded and I need to be put in a psychiatric unit. Is the least restrictive place for me would probably be a group home or some type of facility that's not mental health. Because I don't hallucinate, I don't hear voices, I'm not delusional. Everything that I say, I have evidence for it. Everything is in writing, everything's in recording. I'm not making things up. These people are literally neglecting me. And it's been documented for like the last 4 years. It's in everybody's notes. Self-neglect is still neglect. APS has it. Megan contacted them, the last long-term care person, through iCare. Megan contacted Dr. Meisner. They both had a conversation about guardianship. This is not being made up. They had an actual conversation. It's in my medical documents. And yeah, so at this point, I feel like the only thing that will help is coordination of care, because it's required, and it just don't make any sense to me, the stuff that they're saying. Like, the police is calling and the police is taking their word when they have so many lawsuits against neglect and abuse. It just doesn't make any sense why you would believe somebody over that's already committed crimes over someone who has evidence, and then they're just like throwing it in the garbage, saying they're not going to help. It's just weird. And I can't leave because I have an open case. So I'm stuck in Dane County because I have this open case that could have been avoided had CPS, out of 1 million cases that they've screened out already, stepped in and provided the care. We all know that I'm not capable of caring for myself. So why do you have me full time taking care of autistic children with high needs, with a schizophrenic mother?
What?
Would you like to say anything?
I'm not schizophrenic. What are you talking about?
Do you have anything to say about my care?
Hi, how are you?
I'm doing all right.
Yeah. I really recommended her to go to a group home as well. However, she needs 24-hour care. And I am not a licensed care provider at all. I'm here trying to help her because I'm her mother and her kids is high need. I try to take as much pressure off of her, but I can't take her and like do all those things that she requires. I'm disabled as well. I get a disability check as well. And I do all the cleaning, trying to keep her clear from having to do that, as well as all the care for the kids and for herself. So she does need some assistance. However,
assistance?
Yeah.
I can't remember. I left my keys in my car.
The only other place is an asylum, because if she needs to be cared for 24 hours, and you can't put her in a group home. Then the other place is an asylum.
What do you mean I can't be in a group home? Asylums are not for people who are cognitively impaired or have autism.
Well, in group homes, they don't do all the level of care that you think
they do. It's just the insurance company lied and told the doctor they were going to, but then said, I don't meet those needs.
Okay, go ahead. I'm sorry.
No, I don't have anything to talk to Rachel again. She just brought the phone over, I guess. I appreciate that.
I'm put you in an asylum.
Us as your doctors we don't have universal control over all of these things, and it is important, I will say, for you to, have evaluations, from the people that come out in the home and my choice and CPS and stuff. And, because they actually do these things, more than we do, and have the training and expertise to kind of decide a lot of these things. I'm going off of what you tell me, right?
You're saying way too many words. Like, I need to simplified what you're saying, because there's so much noise and.
Yeah, I hear the kids around there. So, basically, I don't have absolute control over all of these things for you. I can't.
Yeah, we know that. That's not what we're talking about. Coordination of care. You guys keep telling me the same thing over and over, and I keep telling you that you have my medical file, so you know what I've been tested on, what that says, what the impairments are, and the coordination care part. I don't know how many times you talk to My Choice, but I do know that they're supposed to talk to my primary caregiver.
We just met last week. No one has, or I haven't talked to anyone.
Last week? It's been over a month.
Over a week and a half, I forget. Yeah, something like that.
It's been over a month since we met.
No, we saw each other on the 22nd of August.
We haven't met before that?
No.
Oh.
Yeah. So, in order to justify sort of 24-hour.
No, you don't have to do any of that stuff. It's already been done. Dr. Meisner already did that. I'm talking about coordination of care.
Yeah, that just means us talking to them, answering questions, and getting their take on things, and us telling them what we know.
Yeah, so, it's just follow up, trying to figure out why I'm not getting, because this is neglect.
Okay.
So if it's neglect, then there should be a social worker trying to figure out why nobody's not following up on it, because it's not going to go away. And if it's not going to go away, I have autism. I'm going to be stuck on it. I'm going to keep bringing it up over and over until I get the help.
Okay.
And when my mom leaves, it's going to be worse. So then that's when everybody's going to see how the house is when she's not here. And those types of things.
When CPS came out this summer, was she here?
CPS came out 1 million times.
Okay.
And CPS did not do a house, just like My Choice. They don't do a house evaluation. They sit in the living room. They discuss. You're talking about CPS resources. You're not talking about a safety case. Resources. They sit in your living room, and then that's it. They go over what they already know, because I've had 1 million appointments, and they say, okay, what are you looking for? They just waste pretty much my time. We talk about the same things over and over. I can't take care of myself safely. I cannot take care of my kids safely. There's a lot. He elopes. I forget I'm cooking. He sets fires on the microwave. It's the same thing over and over and over again. And then there's nothing done. And then it's always, kids this, kids that. My Choice came here to discuss my kids, my sexual activity, birth control, things that is irrelevant to the insurance company's job. My kids are not none of your business, first of all. Second of all, I can't have kids. So talking about birth control is inappropriate. My sexual activity is inappropriate. I can't remember that I'm cooking. I'm getting in at least 3 car accidents a year. You're talking about the wrong shit right now. I don't want to talk about my kids, because my kids has nothing to do with My Choice. You're not going to help me with my kids, period. We need to focus on what you're supposed to be providing. They agreed to put me in a respite, saying that I had high needs. The beginning of, I think it was the end of last month. End of last month, they agreed to put me in respite in a group home. And then a week later, they agreed that my needs were not high enough. They did a half care plan. They haven't agreed to it. And then now my aunt is involved, and they will not hand over any of my file to her after I filled out a release of information, because they know what they're doing is negligence. And then APS is taking their word for it. You can't take the abuser's word for it. That doesn't make any sense. If somebody calls the police on me and said I beat my children, you're going to take my word for it? Like, I'm not dumb, never been dumb in my life. So I think that's another problem. Before I was beating my head, my memory was great, and I would not be in this program. Probably would never even got the diagnosis of autism, because if I would never got beat in my head, I wouldn't have started looking for answers as to why stuff that I can't remember the time they get out of school. I'm picking them up too early, picking them up too late, just doing a lot of weird stuff. And the more I keep digging, the more I keep finding stuff that's very concerning.
Okay. Well, we will, and our nurses actually have reached out to the case manager. They're waiting to hear back. I see, they had called them on Friday. So then with the holiday weekend, it's just, hopefully they will call back today.
Yeah, it's easier to email them to get them to respond faster.
Yeah, we can't really, in general, do emails about health issues because of privacy laws and such in general. We don't.
Oh.
At least that's our general policy. We don't correspond with other people about things by email because it's not very secure. So.
Oh, Dane County, they have security emails that they send me emails through.
Yeah, at least that's our UW health sort of policy in general. We don't want to send emails outside of our organization about patients,
Oh, that's fine. I get it, but it's all personal information at this point.
Well, yeah.
At this point, it's all personal information. Everybody knows everything about me in Madison, so.
In the long run, I think it would be especially helpful for you, Brisha, to be able to have your own psychiatrist again.
Oh, I'm glad you brought that up, because when I left the hospital, when they said they weren't going to let me go because of safety issues, they said they put in a referral for UW, which I told them was not a good idea, but I'll still do it because I'm always agreeable to everything they say I'm not in my in my notes. So, yeah, she told me she was putting in a referral to psychiatry through UW, and I told her it's really hard to get in there. The requirements to get in, because there's a long wait list, is to want to harm yourself or harm others, and she said she would make sure that they knew that I really needed to have a psychiatrist.
Yeah. I guess looks like that might have been back in February.
No, I'm talking about the last hospitalization I had. When I was sick. I was sick.
You had 2 appointments with a psychiatrist that got canceled, I guess.
Yeah, that was after they were talking about guardianship.
Okay.
Yeah, that was concerning to me that they were talking about guardianship, and then they included a psychiatrist in the notes.
Okay.
So yes, I canceled that, but I'm talking about recently, a referral was supposed to be put in.
Referral. The last referral I see was from February. That's all I can tell you.
Okay, the social worker at the hospital that I last was at for asthma told me that's what she was gonna do. So maybe my choice told her that they were going to do it instead, which they're not, because they wouldn't even find me a primary caregiver.
Well, social worker can't really put that in. I don't know what happened, but I don't see an actual order. I can put in an order.
Yeah, you can put in the order, but if it's through UW, like I said, they're gonna ask me questions, and once they see that I'm not gonna kill myself or kill somebody else, they're just gonna it's not gonna go anywhere. I think I've had a lot of UW psychiatrists, and
you've had a few, it looks like, yeah.
Yeah, and all of them kept saying that I was crazy and I thought I was autistic, and after 12 hours of testing, I guess I'm not crazy and I am autistic.
Yeah.
And that's another reason why I was like, what am I going to psychiatry for? Why don't I just get a prescriber? Because psychiatry is not ever been helpful. I've had like 10 or 12 of them all together in the last 6 years.
Well, a psychiatrist is a prescriber.
Well, I mean, like, but if they're not helping, why not just have a prescriber or somebody?
Yeah, they do have nurse practitioners that prescribe stuff as well. I mean, if you prefer that, but I mean, generally, I feel like the medical doctor would be a little more appropriate for you. But
Okay, and I keep agreeing to it, but the notes keep saying that I'm not agreeing to it.
okay. I don't know. I can't speak to what other people are putting down, or what they heard or didn't hear.
I didn't say that. I don't care.
Yeah. And
I just need for the medication part to be like coordinated, because it's already been said over and over that I need medication administration. And if not, then somebody needs to contact APS and actually follow up on it, because they're screening it out. Because medications that could be helping me with my function is not being administered because I can't remember. And because the people who are responsible over me, because my mom is not, apparently the police believe that my mom is responsible over me. But really, my choice is.
I appreciate you're responsible for yourself as an adult who does not have a guardian or a power of attorney. That's, that's that the police aren't responsible, for you. And my choice isn't. I mean, they have a duty to help you.
If I'm being neglected, then I'm being neglected. Okay. So if I'm not cognitively able to do these things, it's common sense. I used to be a CNA before I was beating my head. I worked with nurses. I worked under doctors. I went to school to be a nurse. So those things I cannot forget, unfortunately. So when people are doing things that I know that they're not supposed to, that I went to school for, for a police officer to tell me that I'm not being neglected when he is, like, how can you tell me that I'm not being neglected? First of all. Second of all, it's not your job. It's your job to report it. You're a mandated reporter. I took mandated reporter classes. So if somebody can prove how I'm not being neglected, that would be wonderful. But nobody can, because the medical documentation says that I am cognitively impaired. I sat there for 12 hours, not on the same day, different days, medicated.
So, when you say that you're self-neglecting, is there something you're talking about? Taking medication, it sounds like.
I didn't say that. I said it's in the APS report. Dr. Meisner said that. A UW doctor said that. I didn't say that.
You didn't say that you're not taking your medicines? Or?
No, I did not say that I was self-neglecting. Dr. Meisner did. Megan did. It's in the APS report and it's in the file.
So do you feel like you are?
I feel like I'm being neglected. Now, I don't really know. Oh my God, I can't with this fucking noise. Why are you screaming? I don't think any of this is working. I'm going to have to upload 30 days of my life and put it on Facebook. It's not working. The shit that I have to deal with every day, and I still I can't even take care of myself. I can't even sleep in my own bed. I wake up and pee every day. It's just too much. It's just too much. When she's gone, it's going to be 5% better. And then when I get the care that I need, that would be like 100% better. I can't take care of them if I can't get help for myself. That's what I keep saying. If they're not going to help me with them, then they have to help me with me.
Yep.
Yeah,
Okay,
I don't.
so
Yeah, I don't.
we'll
I don't know.
try to check in with them about if there are any options for helping you get your medications. I've not come across, home health agencies doing that for people.
We're not talking about home. We're not talking about home health
just
agencies.
That's
not your job.
Program where for people with say with severe schizophrenia, where they do come in and give them their medication every day. But otherwise, I have not come across a program where they do that.
Oh, that's crazy, because like I said before, I used to be a nursing assistant. And I used to see that people came in for autistic adults who were self-neglecting or being neglected, passing them the medication.
Okay. I might not have been involved in a case like that before. I'm just telling you, I've not seen that.
Oh, I've seen it. That's the problem. I've seen it because I used to do the work. So I've seen it. And my choice is supposed to provide it. It's in the plan that I've sent you guys that shows what they're supposed to provide. And it says in their own writing, their own plans, that they're supposed to provide it. If I can't remember to do it, if that's what you call self-neglecting, then that's self-neglecting. But saying that I'm not in compliance when I can't remember if I brush my teeth or not is crazy. If I can't remember if I took the medication, and that's saying that I'm self-neglecting or whatever, that doesn't make any sense. I'm not compliant because I can't remember that I'm taking the medication. How does that work? If I forget that my food is in the oven and I find out the next day that I didn't eat, how is that my problem? If I don't have a guardian because nobody cares, how is that my problem? I need somebody to just sit me down and make me understand all of this, because it doesn't make any sense. You can't make them do anything, but you can coordinate care. That's it. You can't make them provide any type of service. We already know this. But you can coordinate care. And through the Medicaid and Medicare program, it is not an option. But your nurse is telling me, if you're wanting a home health care person, my choice needs to figure that out. What? How are they going to figure it out when they're not coordinating care? If my choice can come in my house when it's literally dirty, visibly dirty, and I have pictures of the entire place the same day that they came in and described me in a long dress with a long sleeve shirt when I'm in shorts and a black shirt, saying that my house was clean, saying that I had 2 levels when I had 3. Just lie. That's fraud. They're taking money, $3,000 to $5,000 per month for me, and not even giving me a ride to back from my doctor's office. Like, this stuff is making me. I'm emotional distress. I have, and then trying to pretend like I'm mentally ill is beyond me. So all of a sudden, I just became mentally ill in 2020. I became mentally ill. I had all of these diagnoses that nobody ever knew about until 2020, and pretending like every time something comes up, it's a mental health crisis. Me not getting care is not a mental health crisis. That's not appropriate. Now, if I was maybe doing stuff that had nothing to do with autism or cognitive impairment, then okay, maybe it could be a mental health issue. I haven't been diagnosed with depression or SI in over a year. I don't know what else, like, diagnosis makes me mentally ill. Like, I don't know why every time I file a police report, I'm sent to mental health officers. I don't understand. How am I mentally ill? I don't get it. My compulsiveness and all of that ruminating and stuff focused on can't transition to other things. That's all part of autism. So I
Which
don't.
is a mental illness.
They told me that autism is not a mental illness. So it is.
It affects your brain. It's a mental illness.
Okay, so they told me it's not considered a mental illness, and in fact, the ADRC would not take any of those diagnoses to let me in until I was diagnosed with autism.
Okay. I don't know, Risha. You're talking about a whole lot of other people that I.
Yeah, I'm not focused on the people. It's just like, it's not. Do you think I'm? Because you said psychiatry. You didn't say like a memory doctor, or everybody's always focused on psychiatry. But psychiatry never knew that I had autism when they were making up all these diagnoses.
There's no drug for autism. There's no, treatment.
But
really, if you have, mood or anxiety problems related to autism, it's a psychiatrist who deals with that, right?
Right.
If you have, some sort of functional impairment, then it gets to the level that you need help, then, whoever does the help does that. So,
so you're saying that would be my choice?
Yes, in this case, my choice would be the ones to evaluate your home situation and your function at home.
No, that's the ADRC.
Well, they can do similar things, yeah.
Yeah, the ADRC determines those things, and then they determine what the needs are. And then my choice is supposed to come in and update the functional screen when there's a change. So so they are, but what do you do when they are neglecting is the question.
You can hire an attorney.
I can hire an attorney. Do you have an attorney I can call?
I don't know.
Yeah, because I've been looking for attorneys for years. And unfortunately, there's not an attorney that does long-term care type stuff. They do personal injury type stuff. So, and honestly, working in healthcare, if somebody was deprived from like their medication or food or whatever, knowing that they needed that service, that doesn't go through an attorney. That would go through like criminal. That's criminal. Like if I had care over my mother and could restrict her from leaving her home or not getting medication when she needed it, when it was recommended by doctors and safety, things like that, that would be criminal. That would not be something that's not civil. I mean, it could be civil, but somebody would be prosecuted, whoever the caregiver is. And in this case, I don't really have caregivers. I just have people that are aware of what's happening and my choice.
Yeah, so appreciate you're responsible for those things.
Because you will not activate a POA, because you said that I am capable of doing all this stuff on my own. That's where it gets confusing. Because if I'm capable of doing all this stuff on my own, then why am I in these programs to begin with?
Which programs are you speaking of?
The long-term care. Because I got in because of cognitive impairment and autism. So if I'm able to do these things on my own.
Appreciate it again. I'm getting to know you here. Our conversations have been pretty normal, and you're remembering lots and lots of details and able to, show me insight into different things.
Like what? Stuff that I learned from ChatGPT?
If you can remember that stuff and use it in real life, then yeah.
So
that counts.
Okay, so me not remembering that I'm cooking or medication, or actually, matter of fact, the last hospital visit, they tested me and said that they weren't going to let me leave. until they talk to my choice about them putting stuff in plan. So all of this stuff that I'm remembering is because it's being recorded. You do realize that. Before our appointments, I'm going back to recordings and to doctor's notes. I have ChatGPT that can help me go over these things before we even have our appointment within like 20 seconds. All I have to do is upload it. So we're not just using just my main memory, but you, like I said before, you have the 12-hour testing, but you don't have it on file.
It's like in like a my chart message. They uploaded it.
But then there's also staff saying that I was tested recently when there were no tests done recently.
So, Prisha, we're like, I'm not sure that, it's worth, or that it's prudent for us to keep going around and around. We're like,
well, because you keep making excuses for neglect and it's irritating.
Okay.
So where do we go from here? How do I get the help that I need? What are we going to do about me being neglected? How do I get a POA activated if I'm not able to do these things on my own? And it seems like I'm never going to get it because we're going back and forth like you said.
Yeah. Well, first, I am not 100% sure that by the medical or legal definitions that you are being neglected. So I can't say that you are necessarily. You're telling me that you are.
Your medical documentation shows that I am, because I have doctor letters in my chart that says that I am, based off what they said.
Yeah.
I wouldn't have known that, but fortunately, I pay for a service called ChatGPT that explains all of those things, which have been explained to your staff, who told me to talk to you about it. Like, neglect is something that just is supposed to be talked to a doctor about it, and they're not mandated reporters.
So this is, if you're talking self-neglect, that's a whole different ballgame.
It's the same thing. It's APS does the same. It doesn't matter if it's self-neglect or whatever. Now, I'm not purposely doing it, but because I can't remember.
So if you're legally, no one's going to take away your right to make your own choices unless it's a severe case where you are in danger.
Is that what the doctor put in the letter? The doctor put it, so safety doesn't mean danger.
So you are not eating and you are losing weight and becoming.
How much weight did I lose recently? I lost a lot of weight, and I wasn't eating until I go to the hospital, because I rely on eating out because I don't cook anymore because I burn food.
In the last year, you've gained 15 pounds and you lost 15 pounds. So
I'm not talking about the last year. I'm talking about since I filed neglect. Since I reported neglect. Over the last 30 days, I lost a significant amount of weight because they weighed me in the hospital.
Okay.
But it's in my medical file over and over again.
Okay.
So what exactly do you guys, are you waiting for me to die, or what are you waiting for me to burn the house down? What is it that you guys are waiting for me to get the help that I need, is what I'm trying to figure out.
Okay. Basically, I think we'll need another visit here to kind of be able to go over things, and it will be helpful to me if we were able to next time talk about the reasons why you might need these things, instead of mostly today has been you telling me that you need them, okay? And my job is to also figure out why and what is a next best step to try to solve the problems, okay?
But you guys know that I'm not able to do that. So who...
Risha, I don't know that. I don't know you. We have met once before, okay?
So you weren't able to look through any of my doctor's notes. When I'm claiming that I'm being neglected, you don't know me, and you didn't have time to look through any of those. I've been responding back and forth for like 2 weeks.
Risha, okay. So I can see what lots of the messages say, that you want and feel like you need this extra help, okay?
No, it's not. No, it's not a want. It's necessary. You have my doctor letters. Like, what are you talking about right now? This is why I should not be communicating with anybody. It's been recommended that I do not communicate and a caregiver or somebody else communicate on my behalf.
Okay. So
what are we going to do about my anxiety medication? Because now you're giving me anxiety. What are we going to do about that?
well, yes, that's what a psychiatrist would be helpful for, okay?
Okay, so you're not going to prescribe me any medication.
You've tried like 15 different drugs, it looks like, over the last 5-ish years, and I made a noticeable difference from what other people have written.
Nobody has done any report on any anxiety medication, so you're making it up. I've just got those medications recently, so nobody has ever gave me anxiety medication.
So when I say anxiety medication, I'm not meaning diazepam, I'm meaning other things too.
Okay, so our meeting today was about diazepam and Adderall and medication coordination. What are we doing about those things?
Well, I am not similar to a psychiatrist you saw a year and a half ago. I generally don't recommend using diazepam.
Okay, so what do I do in the meantime? Because I need a doctor's letter that...
So there's other drugs that are taken every day that help more with anxiety in the long run and that we feel like are safer.
Okay, but I can't take daily medication because you guys don't think that I need a administrative, so I need a letter.
A letter for saying what, sorry?
Your medical opinion on why you think that I should have daily medication. Yeah.
I mean, yes, I want you to take your medication every day.
But I can't because I can't remember. So I just need the letter that what you recommend today. Whatever you want to word it, however you want it, I'm pretty sure either way will work. It will be helpful.
Yeah.
That you're not going to give me any more anxiety medication because you believe that there's medication that should be taken daily instead of PRN the way that I could only, because I can't remember.
Yeah, that's actually a great way of putting it. Yeah. And you would like that letter to go where again? To My Choice, you mean?
I want that letter to go right to my chart.
Oh, yeah, just to My Chart. You'll take care of it from there, is that right? Okay.
Yep.
Sounds good. So, I mean, we could try, let's see, I think, anything else was especially helpful in the past, although maybe you weren't really able to ever take hardly anything on a consistent basis. But someone somewhere along the way thought that Lexapro might have been helpful, so that's a good one to maybe start off with. Okay.
Is that for severe anxiety or is that for depression?
It's for both.
Why would you put me on something that didn't work before?
Because we're limited options and you've tried all the drugs that I have at my disposal. And like you just said, you're not good about taking medication every day. If you don't actually take these drugs every day, they're not going to work very well.
Exactly, which is why I asked for PRN medication, but it looks like you're making my ADA accommodations not ADA accommodations.
That's not an ADA accommodation, okay? This where I have to prescribe diazepam for you, Risha, okay?
Yeah, something that I was getting prescribed regularly before you for SPRN.
So, and they're the experts on this. So, anyway, I will put in an order for that Lexapro at Walgreens.
Wait, is that a medication that psychiatrists are an expert in?
It is, yeah.
Oh, okay. Also, what are you going to do about the Adderall?
We will need to get an updated urine drug screen.
Okay, you can go ahead and put it in right now.
Yeah, we need that every year. It's been about I think 16, 18 months.
No, it hasn't. They just did one recently. How do you think I got it from SSM?
Oh yeah, it's just, sorry, I'm so used to things showing up in our system. Usually it comes over directly into.
Don't worry, I can take another one, or I could, but I'm pretty sure you can get that information since they're all connected, like the documents. You're able to get access to my SSM stuff because Dr. Meisner said I had an appointment that I wasn't having before, so she's able to see that. You can see it too.
It was a relatively limited set of things. We prefer a bit more extensive one. If that's, I guess I would recommend doing that.
Yeah, you can do that.
Yeah.
That'll be actually good.
Okay.
For the group. Can you also get a social worker involved to help you coordinate care with My Choice? Because I think this is going to be a long year.
So our social workers, when you have a social worker through My Choice, they don't get involved.
I've had long-term care for over a year, so that's a lie because I just had a social worker through UW. Her name was Libby Meister. I've actually asked that she stop participating, but she continued, and I filed police reports on her. So I know that's a lie.
Whenever I refer people, they don't do that.
Well, okay. Well, you can report the neglect on her behalf then, since you can't do it, because I said I'm being neglected and abused, and you're a mandated reporter as well. So
you've been evaluated by Child Protective Services and Child Protective Services. You said so.
No, we're not talking about Child Protective Services. I'm not a child. If I was, there would be a big problem because you're aware of my medical diagnosis.
Okay.
So yeah, if you can't get a social worker to do it, because I've already talked to the nurse, explaining to her that I don't think it's appropriate for you to file the APS, but if you want to do it instead of the social worker, that's fine. But nobody has an option of doing that. You're mandated.
I am trying to find a social work note here, Risha. Okay, so I see stuff from SSM. Sorry, I'm not seeing a social work note here. I can do it. I'm just saying that, they almost always.
Because you said that I was self-neglecting. So by not eating on purpose, that's self-neglect. Ripping my hair out is a harm because of autism. That's self-neglect.
These are problems. I wouldn't necessarily say those are self-neglect in every situation.
I mean, if not eating because of cognitive issues, nobody ever followed up after Dr. Meisner's conversation with APS. So they're able to continue to let this self-neglect, if that's all they're calling it, continue.
Okay. We'll have to do another appointment to kind of hopefully better get into all of those pieces.
Okay, so are you going to increase the medication or are you going to leave it where it is?
Sorry, what was that?
I was asking to be put back on Vyvanse because I think that the medication that I'm on right now is causing me like more irritation or like something.
Stimulants do that, yeah. Vyvanse is a stimulant as well. We'll have to get that drug screen, okay?
Okay, so in the meantime, I'm gonna go unmedicated when you already know that I had a drug screen. You're making me very, very irritated because I've already went days without my medicine.
Okay. Yeah, well, if you can come in for that drug screen, we can get things taken care of, okay?
Okay, in the meantime, complaints.
Yeah, I know you got complaints. So.
And yes, and police reports because you are aware that I'm being neglected.
I'm not saying that you're.
You know that I'm being neglected. You got the file. they can investigate it, or they don't. I will go outside of Dane County because this is getting ridiculous. If I had a caregiver, I wouldn't have to be on medication, to be honest with you, because all of the vitamin D and all that stuff that I'm missing daily probably would help. If I had the support that I needed, that probably would help. And I'm gonna do. Oh, you said there's no social worker though. I was about to say, is there like somebody who I could like pay out of pocket to be like a advocate? But you said there's no social worker for me there.
I'm putting in a referral. Okay, we'll see what they say. All right, but they generally don't duplicate services if you already have.
My choice is not an actual social worker. She is a case manager. She is through an insurance company. She is not being, that's different.
Yeah.
Okay, well, have a good day. I gotta go file reports.